It all started in spring of 2015 when we realized at WVU Medicine that we wanted to create signature programs at our hospital so that we would begin our journey to being subspecialized. And one of the top programs was the Heart and Vascular Institute.
Our goals were really to have the most functional room no matter what case needed to go in there. So the hybrid rooms that we built with Philips technology, they have the FlexMove technology with integrated Mackay beds. This allows us to utilize those rooms for anything, whether it be a standard open operation, a hybrid procedure, an advanced endovascular procedure, or even a cardiac surgical procedure. So I think having a vast array of products across the entire spectrum when it comes to vascular care allows Philips to think bigger, to think what's next on the horizon, where do we need to go next, and that's how we wanted to think here in West Virginia. We were thinking we wanted a system that could grow with us, move forward with us, whatever technology may bring, whether it comes from Philips or outside of Philips. We wanted to have a system that was prepared to meet these needs and to grow with us for at least a decade, and we think we got that with the Azurion.
As we've gotten the word out, what's better for a patient to be able to go home the same day instead of being admitted to the hospital. It's absolutely fascinating for me that you can fix an aneurysm with something like the Azurion guiding your imaging and not have an incision. And I can go home tomorrow. And in some places, some instances, they're going home in less than 24 hours. When we chose the Philips, we were looking for several things. The first being high quality care. And Philips provided us with that superior platform so that we could have great outcomes for our patients. But we also wanted to look in a system that was very efficient.
And with Philips and how easy it is to use, helps us, immensely, obviously, because we do 7 or 8, 9 angiograms in a day. Some places, that's a 12, 14-hour day, and with our case, it's 8, 9. And I can't stress that enough, how user-friendly it is. They've just made everything simple.
Speed is important, but only tied with high quality. And also ranking most important was the reliability of the system which we chose, and the consistency. The staff also love the ability to store our procedure cards, and that in combination with how we design these rooms intentionally with mobile storage carts, so we have our specialty specific supplies in the room, just makes it so much easier for the staff to focus actually on the patient instead of worrying about things that we traditionally would be concerned about.
The Azurion FlexMove has allowed us to move the C-arm from the left side of the bed to the right side of the bed. Sometimes we'll come in at angles that'll give us flexibility to not only us at the head of the bed, but also if the surgeons where they're working, as well as occasionally when we're doing TAVRs and things like that.
The Philips technology offered something that was above and beyond what any other company had at the time, and I think still today. The technology involves the bedside controlling. The bedside controls are totally integrated, meaning that at the table side, I as a physician can do any kind of image processing or any control of the imaging equipment by myself. So this allows me to free up my tech who can work in parallel in the control room. They don't need to come in and out of the sterile environment. I can do all the controls required for image processing or image acquisition right at the table side.
We are now performing more complex procedures than we ever have. Our case mix index of the patients we're able to care for has skyrocketed over the past 2.5 years. Really, the technology, by being able to see what we see, to have some of the add-on platforms that the Azurion has with the Vessel Navigator, with IVUS, some of these more difficult procedures, the fenestrated endovascular aneurysm repairs, some of the structural heart valve work, we simply were not a destination for in the past. So we didn't bring in that population of patients prior to this. So that has certainly had an economic benefit to our institution.
From an economic perspective, the Philips system is It's very easy to maintain. There's been no downtime in the 18 months that the system has been up and running. From a turnover time between cases, it is very easy to clean around the Philips system, so our turnover times and our efficiency and patient throughput is significantly improved over other equipment that we used to have in the institution. I think the future vision in vascular surgery, and most surgeons would agree, is a continued push towards minimally invasive therapies. With the Azurion, I am confident that we'll be able to meet those demands from an imaging perspective, and actually excited for the next layer of technology to come out.
The exciting part is we're just getting started, and we've brought world-class cardiovascular care to this state that really has never been seen before. But as we continue to advance our way through fenestrated endovascular aneurysm repair and TCARs and what comes next with heart surgery and robots, I think we're well positioned to have these 3 operating rooms carry us through many, many, many years to come and be able to serve traditional surgery, which doesn't go away based on some patients, but all the latest technology that may come out in the future. I think this Azurion unit will carry us through for many years to come.